Thank you for listening to the podcast on the Rosetta Stone study. In 196 BC, Ptolemy V, an Egyptian pharaoh, wanted to give one message in 3 different languages. First in Egyptian ancient hieroglyphs, then the administrative demotic script, and then finally in what would then have been modern Greek. So for the first time, the Rosetta Stone study attempts to understand the world of dystonia with the Burke-Fahn-Marsden dystonia rating scale and the world of functional impairment in cerebral palsy and other secondary dystonias.
While investigating patient outcomes for deep brain stimulation, we noticed that there was an interesting relationship between functional assessment scales and disability assessment scales. So to test that, we evaluated the predictive ability of functional scales and dystonia scales, and what we found was that there was a great concordance between these scales. So we were also interested in looking at how these scales differed and where patients had very different values for these different scales. Finally, we looked at the role of etiology, of cerebral palsy, and of the proportion of life lived with dystonia in predicting these scales.
So as we mentioned before, we used a dystonia impairment rating scale, the BFM-DRS, and 3 functional scales. The GMFCS, as you can see on the figure 1 of the manuscript, then the MAX, which is the Manual Ability Classification System, and the CFCS, or the Communication Function Classification System. While we see that there's almost a linear relationship when we compare the GMFCS with the BFM of about 20 points, if we look at the results with the MAX or the CFCS, you see that the relationship is non-linear. And this is important because these similarities between the MAX 1, 2 and 3 indicate that there might be non-motor components in children with hyperkinetic movement disorders that we need to take into account, like cognition, motor planning, processor skills. So in conclusion, we advocate for the use of these 3 functional scales, the GMFCS, the MAX and the CFCS, in combination with a dystonia rating scale such as the BFM-DRS for children with dystonia.
Thank you for listening.